And she asked our staff, what do I do? What can I do to make this be better? I am a firm believer that the only way we can make things better is when we start from an honest, open place. I've talked to many family members who get exacerbated because they don't know how to support their friend or family member who is injecting drugs. No matter if you feel like you have the skills to do anything to support that person, we at the 4A's Syringe Access Program have the ability to do that. We're able to refer them to providers that aren't going to judge them and make sure that they're getting interventions before it costs all of us thousands of dollars. We have thousands of people that are using the Syringe Access Program. When we're able to get someone the small wound care that they need before it becomes endocarditis or hepatitis C or HIV, we're able to just reduce the amount of healthcare costs all across the board, which means that each of us pays less to get our care. $60 will get us 400 syringes. So that's at least 4 people that you're able to supply clean injection supplies and syringes that they need to make sure that they're not getting HIV and hepatitis C. Our goal at the 4A's is to get to 0 new infections of HIV. We can prevent HIV and hepatitis C for $100,000, or we can spend $2.9 million treating people after they get hepatitis C. For me, that's a no-brainer. One of my favorite stories is about a young woman who is engaging in sex work, and we'll call her Christina. And when she came into our office to get supplies for injections, she had very swollen legs. She had wounds all over her body, from reusing needles to the point where they were barbed and ripping up her skin, and the swelling was noticeable. Given her very transient lifestyle, we were able to encourage her to, even just a couple times a day, stop in at a gas station, put compresses at her wounds, and elevate her legs, and the swelling went down. A couple weeks later, she was very pale, very sickly, and we were really concerned about her health. We had her go to the hospital, and she actually had endocarditis, which was a heart infection. So she was able to be in the hospital to get treatment for endocarditis and was clean from injection drugs during that time. Through that experience, and because we referred her before it became even worse, where she could have possibly died from her wounds, she connected with our staff about treatment, about how to reduce the amount that she was using. And she ended up leaving sex work. She ended up finding a partner that she really, really loved, and became clean of injection drugs. And a couple months later, she came into our office and brought her fiance. She was so proud of the connection that she had with 4A's, that as she stepped into this new period of her life, she wanted the love of her life to know about us. Every addict will tell you there were several days when they thought, why am I continuing this behavior? I feel like crap. It's hurting my relationships. I don't want to do this anymore. And if there's a person there who has the information and resources that they need at that moment to connect them to treatment and other programs, that is life-changing. And what we have is we've built this relationship with people. They know they can talk to us about anything, whether it's their sexual health, whether it's how much they're injecting, whether it's how to prevent wounds and other pieces of injection drug use. We are also there the moment they want to seek treatment. The moment they're ready, we're ready too. I think between crime and a lot of the different things that we're experiencing right now, people are at a loss for what they can do to make things better. This is one way, one tangible way that you can make this community safer and healthier for everyone. And you can make that happen by donating.